So the pancreas is a gland that's primary job is to produce glucagon. This stimulates the release of glucose in the liver to raise blood sugar whenever we need it for energy. It also is in charge of insulin. This aids in glucose transport in and out of cells and uses up glucose storage when appropriate. The primary disorder with the pancreas that causes issues is diabetes. In this disorder, it's whenever carbohydrate, protein, and fat metabolism end up being irregular, and that results in an imbalance between insulin availability and need. Type 1 diabetes is what people tend to think of as juvenile diabetes, and it's an absolute insulin deficiency problem. Type 2 diabetes is just whenever the insulin is deficient. You can also have diabetes just while pregnant, and this is referred to as gestational diabetes. Normal blood glucose ranges are listed here in this table, and it's important to know these because it can tell us if somebody's having impaired glucose function. Fasting means that the glucose is tested in the blood whenever they haven't eaten. Right? Normally, it should be between 80 and 100. Impaired would be 101 to 125, and if they have a glucose above 126 while fasting, that's the diabetic range. Postprandial means that they've just eaten. Alright, so we would expect it to go up some as they take in sugar. So normal would be 170 to 200, impaired is 190 to 230, and diabetic is 220 to 300. 2 to 3 hours postprandial means that it's 2 to 3 hours after they have eaten, and that should be coming back down as glucagon does its job in the body. Normal should be 120 to 140, impaired is 140 to 160, and diabetic is 200 or more. In gestational diabetes, it's when a mother has high blood glucose during her pregnancy. It's fairly common. About 1 in 5 women, or 18% of pregnancies, experience gestational diabetes. It's considered temporary because it should resolve after the baby's born. What happens is, as the baby grows, the placenta produces more and more insulin-blocking hormones to give sugar and nutrients to the baby. Right. What happens then is it can cause an excess of blood glucose levels in the maternal circulation, which then gives the baby extra glucose that they don't need, and that causes the baby to put on extra weight and can lead to other complications like glucose issues in the baby after delivery. Moms who have gestational diabetes, they should monitor their glucose levels regularly, focus on a healthy diet, low in sugars and carbohydrates, exercise when possible, and possibly have to go on medications if it becomes irregular and difficult to maintain normal glucoses. The next video will pick up with type 1 diabetes, which is an absolute insulin deficiency problem, and is considered chronic hyperglycemia.